Welcome, everyone, to the Advocacy Exchange. If this is your first time joining us, we're honored to be here together. If you've been with us at any time over the last 4 years, welcome back. I am David Craig, CEO of Gryt Health, cancer survivor and caregiver. Our session today is One Voice Makes a Difference, Many Voices Change the World. And we are honored to bring this together with you in partnership with Bristol Myers Squibb. Over the past several years, we have worked with patients, advocates, industry leaders, and more to listen and learn from individuals in their healthcare experience so that we can co-create change together. As a result of all of that work over the last several years, we're proud to share with you the first phase of 2 resource projects that we're unveiling today and will continue co-creating together with you. Before we start, I would love to thank our ASL interpreters being with us today. You can access them and utilize them anytime during the session if you'd like. It's also important to start by acknowledging Martin Luther King Jr. Day and everything he and so many people do to create change. MLK Day is a day to honor that work that we all do together every day throughout the year to make change. All of our work is focused on co-creating change with individuals living these healthcare experiences and creating a better future together. Before we get started with the conversation, I have the honor of welcoming from our founding partner, Bristol Myers Squibb, Jasmine Greenamyer, Vice President, Global Patient Outreach, to start the conversation. Jasmine, welcome.
Well, thanks, Dave. Happy New Year to you. And you alluded to, you said 4 years. Can you believe this is our 44th live session? Kind of crazy to me. Well, as you said, since its inception, the Advocacy Exchange has stayed very close to its mission of hosting honest conversations on important and sometimes uncomfortable topics. And I think we've collectively leaned into this in hopes that we can move the needle both on a community, industry, and even societal level. And these new resource projects that you're alluding to are our collective investments to propel meaningful framework for change. And Dave, you and your team have spent a good portion of this last year, as you alluded to, actively listening to patients and related healthcare stakeholders and organizations. And what you heard won't surprise you. There is still so much for us all to do specifically related to healthcare discrimination. And that's part of why we leaned in, right, and created these community-based tools with input from many of you. And the resources capture not only personal stories, but now we're moving to this clearinghouse, right, for these tools that already exist across multiple organizations. And Dave, to you and your team's credit, you've revamped your website, right, recently to make it easier to navigate and find these respective materials. But let me stop and say I'd be remiss if I didn't recognize and thank the individuals who are willing to share their personal stories and the many organizations that are already actively transforming various elements in this space. And specifically Ebony-Joy, who you're going to hear from very shortly. Thank you. And the other brave individuals who are paying it forward and sharing your stories to help increase, our understanding of these real human experiences. And I would say help increase the urgency for all of us to lean in to do better. This is such an important conversation today. I'd also like to thank the participating organizations like Audrey, who we're also going to hear from the cancer support community. Thank you for collaborating with us on this work. This session is appropriately titled, One Voice Makes a Difference, Many Voices Can Change the World. I think we all believe we need to do this together to make systemic and historically overdue change. So Dave, with all that said, back to you.
Thank you so much, Jasmine, for everything you and BMS do to help humans prevail over serious disease. And I respect and adore how much you put the human at the center of everything in that. And so this conversation today is going to be about humans and lived experiences as we get into those things. So thank you very much, Jasmine.
My pleasure.
I do have one note before we start. Melodie Narain-Blackwell, patient advocate and founder of Color of Gastrointestinal Illness, was planning to be a part of this session, and she has been a huge part of this work as we've been developing it. She had an unforeseen circumstance in her personal life happen, and so she's not able to be here with us today, but we want to share our gratitude for everything she's doing in this advocacy exchange and through her life and work to create change for others. Please keep Melodie in your thoughts. As we start, the first thing I want to say is that for me, this is incredibly significant in my life for two different roles. The first is as a cancer survivor and caregiver, the more I get to hear things that aren't talked openly about or enough about, helps me understand my journey more, but also how to support my peers and others who go through these experiences together. And so my brain is always eager to learn from other experiences because it helps all of us heal. The second part, this is so important to me, is that as the CEO of a healthcare organization, this is all of our opportunity and obligation to co-create change together. And so hearing experiences that I haven't lived or haven't dealt with firsthand helps me bring into our work how important those are in everything we do from the beginning through all of the work we do. And so with that framing, I have the honor of introducing two heroes whom we all respect incredibly. I would love to start with Audrey Davis, who is the Senior Director of Health Equity for the Cancer Support Community. Audrey, welcome.
Thank you so much for that very, very warm welcome. Hi, everyone. I am Audrey Davis, Senior Director of Health Equity at the Cancer Support Community. My pronouns are she, her, hers. Cancer Support Community, if you are not familiar with us, is the largest professionally led nonprofit organization offering 100% free psychosocial support, not only to cancer patients and caregivers, but anyone who has been impacted by cancer. We have 190 global locations, and you'll see behind me the Cancer Support Community and Gilded Club network partners that really are our boots on the ground that engage in this day-to-day work of offering psychosocial support, but also navigation and other resources to cancer patients, regardless of preferred language, preferred pronoun, whether they have a religious affiliation or not, race, ethnicity, location, and a lot of other demographics that I could get into, but I will spare you and keep this introduction short. I am really, really happy and honored to be here today to talk more about not only what the Advocacy Exchange is doing and what kind of resources we at CSC and other great works offer, but also to hear more from folks like Ebony-Joy about the patient experience and what we can be doing collectively, as was mentioned, to really affect change and impact people's lives in a positive way. Thank you.
Audrey, I have to share with you, Gilda's Club was the first place that I turned to after my diagnosis, and it was the very start of me being a part of community. So to have that in my history and do this work together with you is humbling. So thank you. Wonderful. We have another hero that I'm deeply honored to introduce as well. Ebony-Joy Igbinoba is a breast cancer warrior, advocate, and a friend of our community for a long time. And Ebony-Joy, it is so wonderful to welcome you as well.
Thank you, David. I am so honored to be here. I met Gryt in bed a couple of years ago in 2020 during the pandemic in the middle of my treatment. I was sick and I was in bed with my two kids. They were 5 and 6 at the time. I was diagnosed with bilateral breast cancer. I had 4 tumors. I have an ATM mutation, and I had no family history, none known. And so I feel like it was a blessing from God that I got diagnosed at 38 years old and entered into a very aggressive treatment with chemotherapy, bilateral mastectomy, radiation, and now long-term hormonal treatment. And I am just happy to be here because it's not easy at all. I am right now fighting back tears because I want you to hear what I have to say. But I can tell you for sure that Gryt Health and other people, especially Lauren, and people that represent what she does, is making me be able to be here today and smile in the midst of it. So I am just honored to be with you all to speak today.
Thank you so much, Ebony-Joy. I know for me personally, and Audrey, I'm sure it's the same, these issues that we're tackling are so big and so systemic that feeling connected to the impact in humans is the guiding light. And Ebony-Joy, you have been a glowing guide to all of us in doing that work. And so excited to begin this conversation with you. So as we get underway, our mission, the North Star for everything we do, is amplifying the lived experiences of humans so that we can co-create change with people in the way we all experience healthcare in our lives and work towards improving outcomes for everybody. The two topics that we're going to focus on together in this conversation, and then the resources that we'll share with you towards the end of the conversation, have been specifically put together in this first phase to help individuals who are experiencing discrimination in healthcare and for anybody who wants to use their voice to create change in systems. And so with that guide in mind, we would love to start the conversation, Ebony-Joy, and just to hear from you, how have these things affected you in your life? And then now, as you empower so many others, what do they mean to you as an advocate?
So I'll start off with in 2019, when I got diagnosed, I was actually sitting in the same space in my house, and I got a phone call, and everything changed because the radiologist who had done my scan and oversaw my biopsy, he said, you have cancer. And I remember everything going blank and then calling my mom. And I think the first thing that came to mind is at the time I had a 5 and 6-year-old. My daughter was 6, and son's 5. They had just started kindergarten and first grade. And I was like, what am I going to do for them? And I think that everything kind of ran fast forward at that moment. I got a treatment plan, so an amazing team formed. And through my hospital, Wellstar, they said, you're the captain, my breast surgeon, and I got very good options that I thought, because I didn't know any options. I was hoping, I entrusted that they would tell me what was right. But right away, when I entered into this cancer space, I didn't see anyone that looked like me. In the breast surgeon offices, I didn't see anyone meaning patients. I didn't see anyone in chemotherapy in terms of age, but then also being a Black woman. And that was scary because as I'm a reader, and I started reading about survivorship, and I started reading these research articles that had no participant pool that was like me. And then I started hearing that everyone that was like me, a Black woman, was more at risk from dying. And so you take a woman that thought she was healthy. Now I have 4 tumors. It had metastasized to some lymph nodes. We don't have any research. We don't know what to do with you because we don't have a lot of research and data on ATM mutation. We're going to treat you as a BRCA patient and hope that this works. And so anyone that's been diagnosed that's sitting in these chat rooms, when you're faced with morbidity, maybe it's a day, maybe it's a week, maybe it's a month, maybe it's a year. It's scary. And there's this isolation that is placed that makes you feel a void. But there's hope, right? And I tell you, I think, and I'll stop soon, but I can't say enough that literally my children, one of the best moments was being in these online groups. We did a comedy show with Gryt. And so there was no community because the world didn't know what to do with COVID. And I actually had to cancel a chemo session because I didn't have childcare. So there's so many things as a mother, as a Black woman, as just an individual, right? I'm finding who I am as a person. And I think that through this journey, I want other people, I'm speaking to you today. I'm a very private person, even though I speak now, but I'm advocating why I feel empowered because I've sat in rooms like Gryt in my bed while I was sick, and someone said my voice mattered. And when you take me as a Black woman who has been marginalized in this country and in the world, I think that value is a big word for me. And when I know that I'm valued and I'm heard, that gives me hope. Because it wouldn't make sense to fight through all these horrible medications and treatments and, and still be oppressed, right? And so that's where my voice comes from. And I want to thank Forever Gryt for allowing me to share that.
Ebony-Joy, getting to see your voice and see your son and your daughter around you as you've found your voice and begin to advocate is so humbling and empowering. And so we're honored for this, everyone here with us and everyone who gets to see this, to hear your voice through this conversation. Thank you. Audrey, I know you've dedicated your life to this work. What is it like for you with these experiences and the work that you're doing to empower others?
Great question. And Ebony-Joy, again, thank you for sharing and your vulnerability as well. I just want to take a minute to level set because we are talking about discrimination, right? And also access in healthcare. And Ebony-Joy, you mentioned value, right? Discrimination, part of that involves undervaluing or devaluing not only the experiences of other people, but also giving a different value to another person's life, to another person's treatment options, to whether or not because of your own biases, your own opinions, your own prejudices, whether or not this person is really worth as much as the next. And so for me, on a personal level, I've seen this as a caregiver. In my early 20s, my dad was diagnosed with stage 4 colorectal cancer. And, he was a Haitian immigrant, spoke English fluently, but had a very endearing, heavy Haitian Creole accent. And I saw firsthand when we would go to some of his appointments, especially for newer treatment team members or folks who may have been residents or not as familiar with him, some of the facial expressions, some of the way that terms were explained to him that weren't always, I think, what would have been done if he had been valued differently. Now, when we talk about access and privilege, right? My dad had the benefit of having a best friend, also his brother, who was a medical doctor, who was a physician, who could do doc-to-doc consults, who could say, hey, I'm not an oncologist, but I really want you to consider this as a treatment option for him because I've been reading the journals and I've been talking to my oncologist friends, and I don't think we're going in the right direction here. I recognize then on a personal level how important it is to have whatever sense of community, whether it's online, whether it's in person, whether it's a person who is more knowledgeable than you are and willing to go to bat for you, you need to have not only community to empower you, but also be willing to communicate, right? Using that voice about whatever your experiences have been, both positive and negative, to then affect change for yourself and others. And so with that in mind, yes, personally as a caregiver, I saw discrimination and differences in access firsthand, but that now colors everything that I do on a professional level. When we talk about some of our resources, when we talk about things like medical mistrust, which is in fact justified because we know historically and even contemporarily the injustices that varying communities experience in the healthcare system, I think it's so important to recognize that medical mistrust is something that can be addressed. We can do it through education amongst each other, right? Having that racial concordance, but we can also do it through working across the aisle, so to speak. And so I'll get into a little bit more later, but I just wanted to give a little bit more context for how memories of my dad and his experiences, memories of me being young and in my early 20s and being a caregiver for him have now impacted the work and the programs and initiatives that we are rolling out to help all folks.
Thank you so much, Audrey. Ebony-Joy, can we come back to something that you said that struck me so powerfully? As an individual who's part of a community that's typically among the most represented, especially in how medicines are developed and treatment and care are provided, when you talk about there not being information for you to look at, for individuals with your experiences, how have you navigated that and what has that been like?
So, when I was thrust into the cancer world, a few months later, the world shut down with COVID, right? So it was like, whatever was out there, I did not know. And then I think by word of mouth, I can't remember because a lot is a blur in 2020. But I remember getting onto these online support groups. And then people sharing information in terms of financial resources, mental health resources, community resources, everything that was out there. And so slowly but surely, I started in the middle of the night, because you never sleep. When you were one, they pump you up on steroids if you ever get cancer treatment, typically. So you're not sleeping, and then anxiety sets in, so you're not sleeping. And a lot of these medications cause insomnia. And so I would be up in the middle of the night looking things up on different websites and different things. I really had no one to call at the time. And so I was piecing together, my doctors had put together the treatment plan, but I was piecing together my life plan. I'm like, I'm living. And also too, the biggest thing was mental health. I think that's one of the big things in the room that is not discussed. I personally didn't get a therapist or a psychological oncologist, I believe it's called, psychologist, I'm sorry, until a couple of years later. And again, my treatment happened during the pandemic, so there was a lot of shifting and moving. But that was one of the biggest things that has held me together. And I wrote it down because I always forget stuff. But I wrote down that fear doesn't go away, but your community helps you get through it. And so the community that I built through Gryt, so like Lauren, like I say, I would tell her concerns, and then a day later or hours later, she would email me all these things. And I'm like, she heard what I was saying. Oh my goodness. And I don't know who is a parent out there or just anyone to be able to bring who is important to you as a part of this. So like me not feeling ashamed that my kids couldn't be a part of this community is really big, because there's a stigma around families. I'm not sure why, but they were a part of this. And so I think that I'm so happy that I still feel alone. Everyone out there, so don't think that I'm some joyous person that is a positive person all the time. No, I really struggle with a lot of intense emotions of fear and anxiety. And so those are very present to me, but I'm making a choice to surround myself with community and empowering myself through advocating, because I'm sitting here. I'm one of those people that is fortunate that the treatment is working, because 4 years ago, they didn't know, and I'm sitting here with you. And so I'm the clinical trial. There was no clinical trial with someone like me, so I'm living it. And I'm not just a laboratory person. I'm like, I can't take this medication because I'm falling asleep in carpool. Or if anyone has ever been on tamoxifen, I'm like, I'm turning into the Incredible Hulk. I can't control my emotions. And so I think that Audrey and David, how you're saying that lived experience, I'm talking to my doctors. Look, I know I don't see anyone that looks like me, but I value me. You need to value me. And for those that don't feel comfortable, I'm standing in that room demanding that people value you too. So if that answers your question, I'm sorry.
No, thank you so much. I shared in our prep conversation together, one of my heroes, Sheila Thorne, always says, people are not hard to reach, they're hardly reached for. And I know we talked about that. Audrey, all of the work you do is to reach for people. And what is it like in this work for you and everything you do with CSC?
It's so fulfilling. It is incredibly fulfilling. And Ebony-Joy, you mentioned the intensity of emotion. Yes, it is also very intimately and intensely emotional, but fulfilling in the sense that you recognize that by reaching one person or being able to educate one person, whether that's psychoeducation or education on clinical research and options, right? Doing some myth busting and helping folks to understand you're not going to get a placebo, you're not going to get a sugar pill. You should be demanding these clinical trials as part of your treatment options, right? You're helping not only that singular individual, but communities, right? Because they're going back and they're telling other folks. I remember my dad having conversations with some of his male friends and saying, hey, you may not want to put off that screening because I did. And I'm not saying that's going to happen to everyone, but you really need to stay on top of your health. This is important, right? And so the work that CSE does, not only at our network partner locations, but the resources that we offer on our website. You're talking about forums and message boards. We have our My Lifeline, right, which is moderated by therapists. It's available 24/7. There are different forums and subtopics and groups. There are groups for caregivers. There are groups for patients. Things like our Justified Medical Mistrust video series, things like our Frankly Speaking About Cancer informational pamphlets, and also available online, that look at how certain diagnoses might impact certain communities and what these community members can do to better advocate for themselves and feel empowered. Checklists, things that you can ask your oncologist if you're newly diagnosed, things that you should be asking your treatment team. I just want to take a moment though, and while I'm underscoring that this work is fulfilling and it is so important to be aware of all of the resources available through the library and the Advocacy Exchange, the onus is not just on patients and patient advocates. The onus is not just on caregivers, right? Talking about the other side of the aisle, the onus is also on our healthcare practitioners and professionals. I've met a lot of really dedicated, amazing ones that first do no harm is embodied in everything that they do. But I think it's important that we recognize that these practitioners and professionals need to also hold their colleagues accountable. They need to be talking with their peers in the same way that patients are educating each other. These practitioners also need to be educating each other, need to be calling each other out, holding each other accountable, ensuring that there are systems and processes in place so that if a patient is experiencing discrimination, if a patient is not sure about what to do, patient services is not just the first phone call they make or not the only phone call that they can make, but there are very clear systems of accountability and integrity available to our patients and caregivers so that we can re-educate, retrain, in some instances, get rid of some of these professionals who just really aren't doing our patients and our caregivers justice from all communities.
So true and so powerful. Ebony-Joy, for me personally, being diagnosed as a young adult with cancer, fertility wasn't given its significance in my journey. And so to me, young adult cancer in particular and ensuring people have information about fertility is incredibly important. But when I hear this conversation about everybody needs to be involved and needs to own the responsibility of these change, what is it that everybody needs to hear? When we talked in our prep conversation, you shared about, does somebody really see what I'm going through? What does everybody need to be aware of?
So I am an optimist. And so I always assume that racism and discrimination and oppression can't be in certain things, especially like the cancer world, right? Where people are already feeling hopeless. And when I looked at the systemic issues of clinical trials and medical options and just having options of a diverse setting of medical professionals to confide in and trust, right? You're touching my body. I'm physically naked in all of these appointments. And if I'm not physically naked, you're evasive is in terms of I'm sharing all of these things. I'm like, oh my gosh, how are you looking at my body? You're touching my body. You're doing things to me. And there's the history, right? And it's not really far history. It still is today. Like when a couple of years ago, I went to a museum and I learned about the father of gynecology and the treatment that Black women don't feel pain, and the experiments that are taken on people today are just the lack of, are you giving me good options? And I think what's missing from conversations is honesty, especially practitioners talking about their own biases if they don't know they have them, everyone has them. I have them. So if you don't think you have them, you need to figure it out, because we all have them. And I think that one of the biggest things I want people to know, and I wrote it down, is that my liberation doesn't mean your oppression. I'm not trying to say, I just want a seat at the table. I have my kids. I'll share a story. My son, who's now 10, who was 5 at the time, he's my co-survivor. My kids are my co-survivors. They have been through it. They've seen, mommy, why don't you get out of bed? Mommy, why did your hair come out? Mommy, what happened to this person? Why are you crying? I have to tell them that a big thing, Black Panther, I didn't want to tell them that he died from cancer. It's a trigger for all of us. But my son recently said, Mom, I want to figure out a cure for cancer, because in the cancer world, we all know what no evidence of diseases, right? We are still fighting to make sure that what could be microscopic, which I just found out, I can't remember the name, but my doctor referred me over to Mayo Clinic, and he gave me an option of a blood test that can pick up microscopic. Someone can probably type it, I cannot think of the name, but I have a wonderful medical team. But my son, who's talking about a cure for cancer, and he's 10, the impact of what happened in 5 years of his life. I wasn't 5, I wasn't 10 when I heard about cancer. So if we are that, I think what needs to be a part of the conversation is the stigma of cancer means death. If I'm dying a year from now, I want it to make it matter, right? I met a woman who passed away, and she made that last couple of years of her life matter, really, for her family, for the community, for me. And so I think that there's so much power in these conversations, David and Audrey, like you say, that we could be collectively doing if we really can just sit at the table and realize that, hey, we aren't great at some things, but we can change and be better. And you have a 10-year-old, my little son, Osasere, that is saying, I want to figure this out. And can I Zoom bomb my mom and talk and say hi to everybody? And my daughter wants to feel a part of the cancer community and say, Mom, keep on fighting. I think that's what matters. Those co-survivors, and the people that don't even realize they're co-survivors, sometimes that are so, I've communicated, like the people that support Gryt Health for a lot of the respite things that I've participated in. I've gone to cancer camp that I've learned through y'all. I've gotten financial support. I've gotten cards in the mail. All of those people that give you that ounce of hope that you need to get out of bed because you feel so sick and you just don't know. That's what needs to be giving everybody a fighting chance. And I think that I just want people to know that I'm speaking as a Black woman. I'm not every Black woman. And I mentioned BIPOC because I think that there are similarities in communities of color. But I'm speaking from a sense of oppression, and it does touch the cancer community, but that doesn't mean I want other people to be oppressed. I'm against oppression for anyone.
Joy, the last piece that we're going to focus on today, conversation is always the opening and the start point, but action and change is where we all need to move. And so the end piece that we're going to talk to together at the end of the session is all about resources and how we can work together for change. And so I hope we do a good job connecting that back to those comments. Audrey, as we switch into the second topic area around finding voice, right? And how we go from newly being diagnosed and never expecting to have a diagnosis. What is it like in your personal life and in all this work you do to find your voice and then help others find theirs?
So, on a personal level, I think, especially as a caregiver, having been so young, by my standards, young is early 20s, but having been so young when my dad was diagnosed and going through treatment and fairly quickly passed away, finding my voice as a caregiver was a winding road. It was, I think, something that I never expected to do in the cancer and the oncology space. I think having folks like my uncle, who I mentioned, who were so knowledgeable, who had the confidence in their own competency and in their own training, to look up to him, to be able to see how he advocated, to see how he straddled wearing different hats, right? Also being a Black man, also being an immigrant, also having an accent, but also being a medical doctor, and having that love for his brother, his best friend, the impetus and the catalyst for him to continue to fight, really helped me to find my own voice. Of course, as I got more, academic knowledge and professional experience, that helped as well. But I want to caution here that it doesn't matter what the credentials are after your name. It doesn't matter what academic level you're at. If anything, I think it's important, as Ebony-Joy and you, David, mentioned earlier, to really focus on listening to lived experiences, but not only listening, believing people, right? Believing that their experiences are what they're sharing. Some of the stories that I've heard from patients and in our qualitative research and our focus groups sound not only outrageous, but infuriating, unbelievable even. But this is actually happening in this day and age. This isn't the 1970s or the 1950s. This is still occurring. And so in finding my voice, again, I think it's been really important to look at how to then empower others to find and use their voice. And again, on the other side of the coin, ensuring that the people who are listening to this are believing it, are not devaluing certain voices or certain communities or certain experiences because of disbelief, or because they just dehumanize, quite frankly, these people as is because of their own prejudices and biases in healthcare.
I'm trying to find words that feel sufficient. I've never been on the receiving end of anything because of my gender or the color of my skin. And how do we all keep talking more openly so that all of us can feel how awful that is and how much it needs to change? Either of you, please. Sorry.
I'll go, Audrey, if that's okay. David, I think you just saying that matters, right? You being open and honest, and diversifying who you're around to hear the stories that are different than yours. I think that a lot of times we live so segregated, even within our communities, right? I live in a diverse area, but I'm still segregated in pockets of people that look just like me. We still are working on desegregating the United States. And we see differences, but do we really know these differences? Do we sit and have dinner? Where we're really authentic at our holiday dinners, coffee, what do the people look like that we're talking to? And then when we're talking about being a patient, are patients in the room when the practitioners are making decisions, right? Or when we're making treatment plans, are we talking together? Even medications, right? I didn't get a certain round of one of the chemo drugs because I'm like, I can't feel my fingers. And they were like, oh, if you do this, you're going to be permanently damaged. And I was like, what? So if I didn't tell you that, then I would have just never been able to use my fingers, which I still have some neuropathy, but it would have been worse. And so I think that when it comes to, right, I'm going in a room and I'll tell you a story and it might sound strange, but as a Black woman, I had never had surgery besides I had children. But when I entered into a space, and I have been in spaces where the doctor was like, oh, you probably have this, just because they looked at me as a Black woman. And I'm like, you didn't do any tests? Like, I'm smart enough to know. And so that's where the trust and it is not built. But I remember when the anesthesiologist came for my surgery, I was relieved because it was a Black woman. And I was just like, I trusted my surgeon and I love, and the plastic surgeon who worked in tandem. But I was happy to see a person of color that was responsible for my breathing. Because I didn't know. I didn't know if they had to make a change at the end, they'd be like, well, she doesn't matter. Let's just keep on. We lost one. I didn't have that trust I built it now, but you're entrusting individuals that you don't know with your life and your livelihood. And then you take in racism and discrimination that's right in front of you. It's not historical, it's every day. And even if people don't believe it, I'm like, okay, just scientifically, no one like me is in this clinical trial, so you really don't know if this works. How can I trust you with my life? And not just me, but my children, my legacy. And so I think that with that being said, that interdisciplinary conversations and action steps need to happen against intergenerationally, but also race-wise and patient, advocate, everyone needs to talk together. And for those that aren't comfortable talking in spaces, there needs to be a spokesperson to go, because there's a disconnect for sure when it comes to what's happening.
Please.
I'm sorry, David, can you restate the question, please?
For people who don't see these things firsthand, how can we have these conversations more so that everyone understands how awful they are and how much we have to work together to change them?
Thank you. So, you know, I think part of it is what we have in resources like the Advocacy Exchange and the library, being able to disseminate those resources for people who don't see it firsthand, for people who, again, may not believe it or because of their own lived experiences and maybe their own privilege, not recognize that that privilege then can't be projected onto every other community. I think part of it is, as Ebony-Joy mentioned, being able to have not only interdisciplinary conversations, but also conversations through different media, right? And so I'm very much aware of the digital divide. We are meeting online, we're meeting virtually. That works for certain age demographics, that works for certain people who have broadband access, who have technological equipment, et cetera, but being willing to be a bit more grassroots, I think, in our approach to how we communicate this information as well. There are faith-based organizations, there are community-based organizations, there are folks who still prefer to just sit down in a post-COVID world and meet in person for a cup of coffee or to talk as a group in person, whether that be a support group or an educational group. I think it's also, again, back to systems, right? You can tell that I'm very macro focused. Ebony-Joy, you mentioned that comfort in racial concordance, right? And having someone who was your practitioner, who looked like you, who was the same race as you. We need to be looking at how we can better diversify not only our applicant pools for med school and other medical professions and healthcare professions, but also how we can continue to diversify the specialties that folks go into, the choices that people are making. Are we giving children the right support in STEM and STEAM from an earlier age, especially for certain under-resourced communities, to make it possible for them to be able to want to say, you know what, I want to be a doctor. I want to figure this out. I want to be a hematologist. I know that lots of folks who are Black African-American suffer from multiple myeloma. This is something that I want to do with my life, but we can't do that if we don't have these institutions and systems and power making decisions to help further along more diverse education and community.
Audrey, you hit on, when we think about concordance, according to ASCO's numbers for oncologists, they report that there's only 10 Indigenous oncologists in the United States and only 350 Black and African American oncologists out of more than 13,000 oncologists. And so the degree of difficulty next to impossibility to interact with somebody who might relate or understand your experiences is such a systemic problem. And we have to applaud effort in ways that are changing that system to make sure there is more concordance. And I know BMS is doing that with principal investigators for clinical trials, and everything that we do has to be to create more of this support, right?
Absolutely. And I think, I'm harping on a bit right now on the healthcare profession, but if I may just Also education, right? Our educators need to be willing to step aside and look at their own biases, look at their own misconceptions and conceptions about who might make a good doctor, who might be good at math, who might be good in the sciences. I have doctor friends who are very, very smart. Some of them became chief residents in their residency programs, but at some point in their schooling, because of the color of their skin, and in certain cases their gender, we're told, you probably should go and choose some of the soft sciences, or you should do something else. This is probably not the right path for you, simply because that educator didn't think that that student could go the extra mile, could actually make it. And that's completely unreasonable. It's unfair, especially when you have, as you know, as a mother, Ebony-Joy, right, and others who are caregivers, you have children and adolescents and even college students who are impressionable, who are taking what their guidance counselors and what their teachers and professors are saying as law. So I just also want to call out, it is, again, interdisciplinary. It's not just healthcare and medicine, it's also our education system as well.
And Ebony-Joy, this whole making sure we're focused on action and creating change. So let's really jump into that. So when you think about, your life changing the future, and you think about resources to support individuals, how do you live that, and what does it mean for you?
So it's been amazing, actually. I have, starting with my hospital, they asked me to do a news article with People magazine. I've done, and then I did local news stations through Gryt Health. I've done women's magazine with different trips I've been on through cancer organizations that I found out through Gryt, like First Descent. I went kayaking in the middle. Who would ever have thought? I'm like, I thought cancer was scary, but kayaking in the middle of a Hood River in Oregon, I think I was like, okay, this is a lot. But I think I'll start off. I want to reiterate some things that there have been negative things, but I can say that I think I have been my story matters in addition to a lot of things, because I have really had a lot of support and from my family and my church and community members and like Gryt Health, but also my medical team. They listen to me, and they're giving me options. And I have been in rooms at conferences, and I actually led a talk for Black women, just a conversation and discussion. And I heard some horror stories from these women, and I'm like, oh my gosh, I need to tell you what to ask for, because this is not right. And so I think that I'm very fortunate as a Black woman that I have received a standard of care in my breast cancer journey. I'll admit some things, and that I do feel heard in my specific offices. And so I think that I want my story to be shared so people know what, especially other people of color, to expect. If your doctors aren't asking you to do clinical trials, if they're not asking you, not listening to you talk about your anxiety and worries about recurrence, and not saying, hey, I didn't even know that a doctor had asked Mayo Clinic for another possible drug that I could possibly use. I didn't know that. But communicating with my doctors may allow that. So I think that one of the things that needs to be done is people talk within their communities. I know as a Black woman, there's a lot of myths and misinformation, and which people don't go to the doctor at all. And then it's too late. Or they try other methods and then they go and then it's too late. Or they don't have options, right? I'm very fortunate. I live in a metropolitan city. 5 minutes away, I have access to some of the best doctors. I'm very fortunate. But with virtual options, maybe we can figure these things out. So getting people to actually get options for medical care. But overall, I think is the living through it, right? I think cancer for so long was focused on death and dying, at least for my generation. I'm the first year of millennials. I was born in 81. And I think that all I knew about cancer was that people died. And so now when you see young people, and I've met young people that, have lived through childhood cancers or in their 20s, and or like me now, I'm 38, and they're like, hopefully I'll live. I have my grandmother who just celebrated her 98th birthday. And so I I feel like I have longevity in front of me. But what does that mean with these medications that we're not, we have data, but have they been examined in a person like me, right? I have 2 kids. Can I be on a medication that doesn't allow me to drive? I don't think I can let a 10 and 11-year-old drive just yet, right? And so I think that the conversations of what it means to have these medicines, the interactions with the doctors, what a real treatment plan should look like. What is the standard goal? I asked my oncologist, I was like, you're in a suit giving me this medicine. How do I know you mixed the right cocktail together? They're like, oh no, we have a whole like step process, even right before we mix the medication together. And so being able to ask questions is the big thing, and knowing that the answer you got is correct. So exposure of what it really looks like. So like David, right, where you haven't experienced things, you sharing what it looks like to have a good experience so people can know what to expect and demand.
You both were talking about believing, believe someone when they share their voice. And Audrey, when you said that, I remember a presentation that Dr. Catherine Alfano from the American Cancer Society gave at a conference one time. And, in her opening slide, she said it wasn't until the early 70s that the word cancer was even included in newspapers. It would say, died of a serious illness or something. But in our lifetimes, the open conversation about these things is still relatively new. And then when we get to these really deep and oftentimes uncomfortable things about humanity, it is a relatively new topic. And so in your work and cancer support community, how do you help elevate that openness and help people find and use their voice?
I'm so glad that you asked this question, because when we talk about historically under-resourced and underserved communities, we have to recognize that finding your voice or feeling empowered to advocate for yourself, especially about something like cancer, which is often stigmatizing, can look differently for different groups. And so at CSC, Cancer Support Community, a lot of our qualitative research, a lot of our engagement with patients, especially at the headquarters and the network partner level, looks like asking varying community members, hey, like, is cancer even a word that you use? There are some cultures and ethnicities that don't even say the word cancer because of, what we might describe as superstitious beliefs, but for them, it's a very real belief. You shouldn't even say it. The word cancer doesn't translate into several dialects and languages. And so with helping folks find their voice, it really is important, again, to listen to not only their experience, but listen, and with my background as a clinician, for what they're not saying, right? Listen for whether they even have someone that they would feel comfortable talking to who maybe looks like them or doesn't look like them, who can give them advice on how to ask questions. If they're not comfortable using certain words or certain terms, or if those terms don't even translate, then what kind of bridging needs to be done between our healthcare practitioners and our patients and caregivers and those impacted by cancer, so that the advocacy and the voice can actually be heard and understood in a way that makes sense for the patient and the persons going through the cancer experience.
The last topic that we're going to focus on is these resources to both help people experiencing discrimination and to be able to use their voice. So, Audrey, I know the work that you all are doing, in justified medical mistrust and all the resources you're creating. What is the power? What does that mean to our future to be able to have those things?
Especially for the Justified Medical Mistrust docuseries that we have, which features past clinical trial participants from communities of color, as well as our Black and African American medical doctors speaking side by side about clinical research, benefits, the history of medical mistrust, why it exists, et cetera. I think it's so important because, again, it's not just affecting that individual viewer or that individual participant, but this is something and knowledge that can be passed on through generations. A lot of what we're talking about here today, in terms of knowing what to ask for, knowing how to advocate for yourself, knowing who to talk to, has to be learned through conversations. And it's often not going to happen in an exam room. It may sometimes happen happen in the waiting room or in the lobby, but it usually is more organic than that. And so I'm really excited that, again, we can not only offer the video series, but resources on our website and other partners with the Advocacy Exchange to be able to not only educate, but empower in ways that make sense for a variety of communities. Each one, teach one is the motto there.
Love it. We're going to show those in just a second before we wrap up. And so I'm so glad you framed the significance of it that way. Ebony-Joy, Lauren on our team, you often have conversations about, well, how do I become an advocate, or what does it mean to advocate? And Lauren always says, sometimes just rolling over in bed and saying, I need help is the start of advocacy. That is the moment that advocacy starts. And then I look at you finding your voice and your kids around you and empowering them, and then all the circles of people around that get to hear your voice. What is the power of that for you?
The power is that legacy, David. I always tear up when I mention my kids and this story, but to see the empathy and the growth that they've had, it makes